Thank you so much, Pepin. And I'm in the room here in Bangkok with some colleagues, which is nice. So as Pepin mentioned, we'll be talking about the comparative cost effectiveness of a face-to-face versus a digital demand creation model to promote the consumption of pumpkin and okra in Ethiopia. So this, I will present the first part, and then I'll hand it over to Liz, and then we'll hand it over to Tinsaye as well. So just a little bit about the background and motivation for wanting to do such a study. So of course, as we're all well aware at World Veg, vegetables are at least one of the main keys to having a healthy diet, but consumption globally is quite low, and Ethiopia is no exception to that rule. So in some recent reports, we found that 85% of Ethiopians consume 0 servings of fruits and vegetables daily, and that only 1.5% of people in Ethiopia actually meet the WHO's recommended 5 servings of fruits and vegetables per day. So, of course, there are many forces that make it so that vegetable consumption is a challenge in Ethiopia and elsewhere, some of those being a growing population and urbanization, which put major strains on the food system, and, of course, introduce barriers to accessibility and affordability and availability and desirability of vegetables, as Pepin also mentioned. So one solution is working with and promoting opportunity vegetables, which are nutrient dense. Sorry, okay, he's muted. which are locally produced, usually or locally available, nutrient dense, climate resilient, and unfortunately underutilized in our modern diets, in which we prioritize just a few vegetable crops. So we have identified the need to create demand for local opportunity vegetables in Ethiopia. So that's what we are attempting to do. What we attempted to do in this project. Oops. Okay. So we had 3 major objectives of this particular project. The first was just to prioritize the local opportunity vegetables that will be the most important to promote in Ethiopia. The second was to test these 2 different demand creation models intended to increase consumption of the local vegetables, the local opportunity vegetables that we chose. And then the third is to generate not only evidence on the effectiveness of those demand creation models, but their comparative cost effectiveness to be able to really make this a policy relevant project where we can give concrete advice to policymakers on the most cost effective method to increase demand for these opportunity vegetables. So we had 3 phases of this project, and each had their own methods. So the first phase was this vegetable prioritization and intervention design phase. So we did that through multi-stakeholder consultations, and I will go into a little bit more detail about those in a minute. The second phase was the cluster randomized control trial that we did to test the cost effectiveness of those different demand creation models in increasing demand for those local opportunity vegetables. And then the third was a small qualitative study in which we used focus group discussions to understand local perceptions of the opportunity vegetables that we chose. So for the first phase of vegetable prioritization and designing the interventions, we first conducted a literature review on all of the opportunity vegetables that are available in Ethiopia, where they're produced, who eats them, all of the information that we could find in the literature on opportunity vegetables that are available in Ethiopia. So then we used that as a basis for the next step, which was we called together multiple stakeholders from every area of the food system. So we included people on the production side, we included farmers, we included aggregators, and we included transporters. We included people in marketing of vegetables, so people from retail markets and other situations. And then we also included consumer groups. So we really tried to hit every part of the food system. And we invited those people to come together both at the national level, and we also held separate regional workshops. And we did this in early 2025. And so those people were tasked with taking a long list of opportunity vegetables that we had identified during that literature review phase and narrowing it down to prioritizing just 3 opportunity vegetables. So the first thing that they did was actually they spent a half a day, actually, I think, or at least a full morning, coming up with what are the important criteria on which they wanted to prioritize the vegetables. So they ended up coming up with 8 criteria that I listed here. So those were the economic value of the crops, the nutritional value, the adaptability and climate resilience of those crops, their taste and palatability, their affordability, their level or their intended or assumed level of success as a source of income for women or other unemployed populations, their ease of access on the market, and then of course their cultural acceptance. So taking all of those things into consideration, the multi-stakeholder group then ranked all of the vegetables in a systematic prioritization exercise and ultimately came up with the top 3 vegetables that, for all of those criteria, being pumpkin, okra, and moringa. And of course, this is very specific to Ethiopia, and I think that there were slight differences at the national and regional levels, but those were what were chosen, I believe, at the national level. So once those were chosen, the stakeholder group also documented what are the barriers and enablers to use of those specific vegetables, what are the knowledge gaps around those vegetables, and then what are the opportunities for interventions that we can design to get people to eat more of those vegetables, and what are the different roles of each of the stakeholders who were present. So that was the first phase. So then in the second phase, once we had that, sorry, I keep getting little bits of feedback. So once we had the vegetables chosen and the intervention ideas designed, we decided to test different demand creation models. So we did a cluster randomized trial with 3 arms, and actually in both of the intervention arms, we did a similar sort of campaign in terms of the content. So the campaigns consisted of giving people recipes for pumpkin and okra, doing demonstrations of how to cook pumpkin and okra, providing some nutrition education, especially on the specific nutritional benefits of pumpkin and okra, and then giving some food budgeting advice. So both of the in-person arm and the digital media arm received those same types of interventions, but what really was different was the modality. So in the in-person social behavior change arm, the participants had 3 weeks, and they had 1 3-hour session per week. And you can see sort of a little example of what that looked like from the pictures on the top row here, where you can see the cooking demonstration, and then that people, were actually able to be there and to taste what they cooked. And then the digital media campaign was delivered through Telegram, which was deemed as the most appropriate sort of social media or messaging app in Addis Ababa, where we did this study. And so that was over a 4-week period. The participants got 12 short videos, and they got 24 static messages. So you can see here an example of a static message on okra, and then a still frame from a video. And I actually wanted to, on the next slide, show you a couple examples of those videos, because I personally think they're quite interesting and very well done. And even though they're in Amharic, and of course, many of us cannot understand the words, but I think that just getting an idea of what we presented for the short videos in this digital media campaign could be interesting. So I'm just going to play each of these short clips. I think they're about a minute each for you. Oh, and I just also wanted to mention that the people in these videos are influencers, like sort of famous local chefs in Ethiopia, that the group that we worked with to design these campaigns was able to really find important people to deliver these messages, which I think is also really, really interesting. So here's hopefully this works.
ዛሬ መዘጋጀላችሁ የዱባ ሾርባ ነው። እንግዲህ ማዘጋጀት ግብአቶችን በተራ በተራ አስተዋውቃችኋለሁ። ሁለት መካከለኛ የሆነ ቀይ ሽንኩርት እናዘጋጃለን። አንድ ባሮ ሽንኩርት አለን። 4 ክር ደግሞ ሰለሪ እናዘጋጃለን ማለት ነው። በማስከተልም 2 ቆዳ የተላጠ ቲማቲም፣ 1 ሾርባ ማንኪያ ደግሞ የቲማቲም ድል እናዘጋጃለን። እንደምትመለከቱት ወደ 250 ግራም የተከተፈ ዱባ አለኝ። ጮና ቆንጆ ለማድረግ ቆንጆ የዱባ ሾርባ እናዘጋጃለን። እንግዲህ አሁን ወደ ስራው እንገባለን። በቅድሚያ ድስት ከቃደም በኋላ ዘይቱ እናገልና በቅድሚያ ቀይ ሽንኩርት፣ ባሮ ሽንኩርትና ሰለሪን አንድ ላይ በመጨመር በዘይቱ ከ5 እስከ 6 ደቂቃ ያክል በደንብ እናወስዳለን። የምግብ መፍጫ ከሌላችሁ ዱባውን በደቃቁ መክተፍና አብሮ መስራት ይቻላል። መጨረሻ ላይ በሹካ ዳጥራ ታደርጋችሁ በደቃ አድርጋችሁ መጠቀም ትችላላችሁ። ከዛ በኋላ በማስከተል እንደምትመለከቱት ዱባው ይገባና ከሽንኩርቱ ከሰለሪና ከባሮ ሽንኩርቱ ጋር አብሮ ዱባውን እናብሷለን። ትንሽ ቀርነን ለ3-4 ደቂቃ ድረስ በደንብ አድርገን እናበስላለን። ይህ ካበሰልን በኋላ በማስከተል የቲማቲም ድልህ ጨምረን ከአንድ ደቂቃ በኋላ ወዲያውኑ በማካተል የተከተፈውን ቲማቲም ጨምረን በደንብ አድርገን ዱባውና አትክልቶቹ እስኪገባ ድረስ እያማሰልን ለ5 ደቂቃ እናቆየዋለን። በስተመጨረሻ እንግዲህ እንደምትመለከቱት ውሃ ጠብ ያደረግነው ዱባ መብሰል ካረጋገጥን በኋላ ውሃ ከልሰውና ከ10 እስከ 12 ደቂቃ በደንብ እናተከትከዋለን። አሁን እንግዲህ ዱባው ደርሷል። ትልቅ ጠቀስ አድርገን በመፍጫ ማሽናችን እንከትና እንፈተር ወደ ድስቱ በመመለስ በትንሽ መረቅ ወይ ደግሞ ውሃ በመቋጥነን እናተከትከውና ጣቡን ካስተካከልን በኋላ እንደምታዩት በዚህ መልክ ለምግብ እናቀርባለን። በነገራችን ላይ ዱባ ከፍተኛውን ጥቅም አለው። ባለው የፋይበር ክምችት የደም ድርቀትን ይከላከላል። እንዲሁ ደግሞ ለደም ዝውውር በጣም አስፈላጊ የሆነ የተፈጥሮ ጸጋ ነው። ተጠቀሙት። ተጋብዙ ይባካችሁ።
ሄሎ ዛሬ ደግሞ የኦክራ ሾርባ አሰራር ነው ማሳያችሁ። ለማታውቁት ይሄ ኦክራ ይባላል። አሰራሩንና ጥቅሙን ደግሞ አሁን እነግራችኋለሁ። መጀመሪያ ላይ ሽንኩርት በደቃቁ እንከትፋለን። ቲማቲምም እንደዚሁ፣ ካሮት ደግሞ በትናንሹ እንከትፍና ኦክራውን ደግሞ እንደምታዩት እንቆርጠዋለን። ጠርዙንና መጨረሻ ላይ ያለውን ቆርጠን እንጥለዋለን። ከዛ ድስት ላይ የተከተፈውን ሽንኩርት እናደርግና መጀመሪያ ዝም ብለን ካበሰልነው በኋላ ዘይት ጨምረን እናቅላለዋለን አብረን። ያን ካደረግን በኋላና ሽንኩርቱ ሲበስልልን በደቃቁ የከተፍነው ካሮት ጨምረን አብረን ጥብስ እናደርገዋለን። በመቀጠል እሱ ሲበስል ቲማቲም፣ ነጭ ሽንኩርትና የቲማቲም ድልህ እናደርግበትና አብረን በደንብ አድርገን እናቁላለዋለን። ከተቁላላ በኋላ ጨው፣ ቁንዶ በርበሬና ሌላ የምትፈልጉትን ቅመም አድርጋችሁ ማብሰል ነው። በመቀጠል ሰለሪ ወይም ደግሞ ፓርስሊ ማድረግም ይቻላል። አድርጋችሁ በደንብ ታሹታላችሁ። የሚፈልገውን ውሃ ከልሶ እንዲተከተክ ወደ ጎን ማድረግ። ከተንተከተከ በኋላ በርሜል ቺሊ ፓስታ የተጠቀምኩት፣ እናንተ መኮሮኒ ኖርማል ፓስታ መጠቀም ይቻላል። ከዛ ፓስታው ሊበስል ትንሽ ሲቀረው ነው ኦክራውን የምንጨምረው። ብዙ ሰዓት ላይ መቆየት የለበትም። ኦክራ ለሰውነታችን ብዙ ጥቅም አለው። ከእነሱም ውስጥ ጥቂቱን ልንገራችሁ። የመጀመሪያው በጣም ኢሚዩን ሲስተማችን ወይም ደግሞ የበሽታ መቋቋም ኃይላችን እንዲጨምር ያደርጋል። ከዛ በመቀጠል ለቆዳ ጥራት፣ ለሃይድሬሽን፣ በውስጡ የውሃ መጠን ከፍተኛ የውሃ መጠን ስላለው ለሃይድሬሽን ጥሩ ነው። እንዲሁም ደግሞ በዝቅተኛ ዋጋ መገኘቱ በጣም አሪፍ ያደርገዋል። ኢኮኖሚካል ነው። ይህንን ይመስላል። ሞክሩት። I love you. Bye.
Okay, so I hope that was interesting for everyone, as it's as interesting as it is for me. But I think that also it shows not only that the recipes were obviously culturally relevant, but I think that they were also discussing, as they showed the recipes for pumpkin and okra, they were discussing the nutritional benefits at the same time. So sort of integrated nutrition and education and recipe preparation. So so the outcomes that we were measuring, that we were interested in looking at, was of course consumption of pumpkin or okra in the last 15 days. And we also we estimated the quantity of pumpkin or okra consumed in grams in the last 15 days as well. And then we were also interested in, whether or not people gained knowledge on the health benefits of pumpkin and okra through this intervention. So we collected the baseline data in July 2025 and the endline data in October 2025. So this was a relatively short intervention period. And then we analyzed those data using difference in difference to estimate the changes in intake and knowledge and practices, and then to link the the per respondent costs to the percentage point increases in intake, we calculated incremental cost effectiveness ratios. So basically we took the difference in cost divided by the difference in effectiveness. And I will pass to Liz now for the talking through some of the results.
Thank you. Can you hear me okay?
Yeah.
Great. So so as Ilana said, so here are our sample characteristics. We originally sampled about 900 participants, and then in the end line we had in total 865 respondents in the end line. I've displayed them by treatment arm, but as you see, there aren't any very big differences between them, which is good for us. And we did this by it's not Kabeles in the city, but we did this by little neighborhoods, each different arm, and there was a space between them, so hopefully there was less spillover effect. When we went for the baseline, we asked the households who was making decisions about the food that is cooked. And this is a complicated question to ask, but it ended up being mostly the adult female in the house that we interviewed. And on average, they're about 42 years old. The average household size was just about 5 people. And at the baseline, 94% of the sample had tasted pumpkin before. Pumpkin is quite a common vegetable in Ethiopia, but it is looked at as food for the animals or food if your household is poor or going through a difficult time. So there's a lot of cultural stigma against eating it, and people haven't been taught how to prepare it in a delicious way. So even our local partners, we had a icebreaker where we talked about our least favorite vegetable, and they all said pumpkin because it didn't taste good. So they're familiar with it, but they don't like it. And then for okra at the baseline, only 20% had tasted okra before. And this is because okra is more common in West Africa, even though it's in the markets in Ethiopia and was identified as an underutilized vegetable. Mainly the people who were either expats in Addis or had traveled and worked abroad and familiarized themselves with it. So a lot of people had no idea what it was. And then we have the share of the participants that participated in the intervention that they were assigned to. This was definitely our biggest challenge. In the in-person, only about 50% of those participated. And that 50% is if they attended at least one session. And remember, there were 3 sessions. The majority attended 3 sessions, but not, probably about 20% only came to 1 or 2. And this was for various reasons. The people identified Saturday morning as the best time to do this, but also it's the weekend and they have other commitments. So that part was challenging. And for the digital arm, only 34% of the participants participated in it. The challenge for this arm was that some people didn't know they were assigned to it. I think because maybe there's many channels on Telegram, it's very common. It could have gotten lost. And additionally was because of the videos and the messages used a lot of data. So actually halfway through the intervention in the digital arm, we realized this and we were able to provide a little bit of data to the participants and then inform them that we did this and then they were able to access the community and see all the previous messages. But the response was still a bit low. Okay, next slide. So first we'll present the okra results. So we asked people about the feedback of the intervention for those who participated. So this is that subset of the people who actually participated. And we have whether or not they learned new okra recipes from the program. 93% of the in-person reported learning new recipes, while only 70% of those who participated in the digital. And then we asked, okay, so in those, the end line was about 2 or 3 weeks after the intervention. And so we asked, how many okra recipes have you done at home outside of the intervention? And so the average was 0.68 for the in-person and 0.15 for the digital. But then we asked that those who did make recipes on the taste and the ease of the preparation on a scale of 1 to 5, 5 being the highest and very easy. And so the in-person had a higher score, over 4 points, while the digital had a slightly lower score. And I think that makes sense to us because those, the in-person, they had already experienced working with the vegetable. But still, for the ease of preparation of the digital group, it's still a positive, but it's only 9 people. And then the likelihood of people making an okra recipe again was quite high for the in-person and lower for the digital. And so I think for this, it's, as long as we could get them to try it, the responses were positive, but it was that barrier. I think okra was still a little too unknown for some people, even in the in-person group. Next slide. So here are the impact results for the okra. Oh, sorry, and there's one thing I wanted to mention about the in-person, or is there, you can leave it, Ilana, sorry. The way, because there were 3 sessions, and so one session was on okra, one session was on pumpkin, and one session did a recipe that mixed okra and pumpkin. And so, but there were always review sessions, and they talked about the nutritional benefits as well. So for those people who only didn't attend all of them, they were still exposed to some of the other information that they had missed in the other sessions and given recipe cards and such. But okay, here we have some positive impact results on the okra consumption. So the okra consumption at the baseline, only 1.9% of the households had eaten okra in the 15 days before the baseline. And then we found a 12% increase, percentage point increase for those in the in-person arm. We did not find a significant effect on in the digital arm. And then we also compared, that last column is comparing the in-person and digital arm. So clearly the in-person arm had a much higher impact on whether or not the households consumed okra. And then if they consumed okra, we asked to estimate the amount in the 15 days. And this is in grams, so it is quite small. But again, this may have just been 1 serving of okra within 2 weeks. But still, that's a start. That's more than nothing. And so we again found the in-person arm, which with a much higher impact than the digital arm, increasing 7 grams compared to the control group, and increasing 9 grams of consumption compared to the digital group. And for each vegetable, we created kind of a nutrition quiz about certain benefits for each vegetable. And so those were asked at the baseline and then asked again at the end line, and all of the benefits were discussed in the interventions. And so we also found that the health benefits of okra we had a bigger impact on the in-person arm than in the digital arm. So overall, good, small results, but still significant for the in-person for okra. Next, please. And so next are the pumpkin results. And remember, pumpkin was already quite well known, just not liked to this population. And so we found most people reported that they did learn new recipes from the program. And for the recipes that they tried at home, for pumpkin, this was over 1. They tried 1.4 recipes on average at home. And the digital group also was trying a few more, almost 1 at home compared to the okra recipes. And again, when we asked them to rate the taste and the ease of preparation, we find very positive results. Very tasty, quite easy to prepare on that subsample of people who actually did try it at home. And there is quite a high likelihood that they may try those recipes again. Next. So for the impacts on pumpkin consumption, unfortunately, we didn't find any significant influences on the likelihood of consumption or the grams. But again, this may be, I'm not sure we haven't dissected it fully yet, but it is an unexpected result. and at baseline only 7% were consuming pumpkin, and yeah, this didn't change by the end line. They did retain some of the health benefits known, almost like a slight increase on the in-person session. So there's more knowledge being shared, but there are lots of barriers for pumpkin that maybe we can discuss if people are curious about that. But I will let Ilana go on to the cost effectiveness results. Thank you.
Okay, so yeah, thanks Liz for telling us about the effectiveness. And now in terms of cost effectiveness, we used an intention to treat framework as well for cost effectiveness, because of course, even though we had a low compliance rate, we're still paying for the intervention as if it were for all the people who were supposed to participate. So that is how we calculated the cost effectiveness as well. So the digital intervention cost $105 per respondent or per participant, whereas the in-person intervention costs $216 per participant. So quite a bit more expensive to do in-person delivery. So the additional cost of in-person delivery was about $111 per person. So of course, if you add that up across all the people, that can be quite significant in terms of programmatic decisions. And then the graph on the right, I'll just explain a little bit how to interpret this. So this is a cost effectiveness plane. And in this quadrant here, in this quadrant, which is the upper right quadrant, you have anything that would be more effective. So we have effectiveness is along the bottom axis and cost is along the side. So anything in this area would be, the further it goes to the right, the more effective it is. And then the further it goes up on the graph, the more costly. So here you can see the point estimate for the incremental cost effectiveness ratio for, this is only for okra, by the way. I didn't do this for pumpkin because pumpkin had no significant difference in effectiveness. But for okra, for each additional person that ate okra, or that reported eating okra, it will cost $790. So it seems like a lot of money potentially to spend on such an intervention to get one additional person to consume okra. So what that shows is that yes, there was okra had a higher level of effectiveness. The intervention for the in-person intervention had a higher level of effectiveness, but it was much, much more costly. So, a policymaker would have to decide what is sort of worth it to them in terms of more effect versus more cost. They can draw that line where they want. So if you look at, so that's looking at, the intention to treat framework. If you look at it in terms of only among compliers, so only people who actually participated in, either the digital arm or the in-person arm, who actually went to the sessions or who actually read the messages, then it takes the cost effectiveness ratio down to the incremental cost effectiveness ratio down to $453 per additional respondent consuming okra. So, you might say that's still a lot of money to spend on one additional person consuming okra. But we made the assumption as well that the person is responding on behalf of the whole household. So it's not actually, in reality, it's not actually just one more person consuming okra. It's actually, if you take the average household size of 5 people per household, it's actually 5 people, per respondent consuming okra. So, and we think it's a fair assumption to say that someone who, is responding on behalf of their entire household, because whatever they eat is probably what the household ate. And so then we can estimate that if they're responding on behalf of the household, and we include the whole household as people who are consuming okra, then we estimate that would be $161 per additional person consuming okra, which, then you might think that's actually quite a reasonable amount of money to spend to get more people to consume these very healthy and climate resilient vegetables. So yeah, the summary of that is that the in-person intervention was substantially more effective, but also more costly, and a policymaker would have to decide what their willingness to pay for, an increased level of effectiveness would be. So I'll hand it over to Tinsaye now to talk through the rest of the findings.
Thank you very much, Ilana, as well as Liz. I hope I'm audible, right?
Yes, you are.
Super. So beyond measuring these consumption outcomes that Ilana presented, we also wanted to understand a little deeper the reasons behind why people really consume, or even for that matter, even avoid the consumption of pumpkin and okra. So for this, we conducted around 18 focus group discussions across 6 subcities in Addis Ababa with different segments of the population, like adult women, adult men, the youth as well, disaggregated by gender as well. So these discussions really actually helped us to better understand the social perceptions, the cultural meanings and underpinnings behind the consumption of these two vegetables, and actually the practical barriers as well that really shape the consumption of okra and pumpkin. So what I personally found most interesting were the qualitative findings, more of because they revealed the deeper social perceptions and cultural meanings attached to the consumption of these two vegetables. So from the findings, it's very clear that food choices they are not really shaped by just the nutrition and the affordability, but also by the perception, the identity, and the social meaning behind the consumption of these two vegetables. And we have seen them separately because we had different perceptions between the two vegetables. For pumpkin, many of the participants, particularly the youth, they use associated it with kind of poverty, a kind of poor man's food and rural life, and food for the older generation. So even though pumpkin is quite familiar and nutritious, even from the presentations that Liz and Ilana covered, it's not really always viewed as desirable, especially in the modern urban diet. When it comes to okra, it's a little bit different and had also a different challenge. That is, like, many of the participants were simply unfamiliar with it. As you can see from the previous presentation, I think it was 1.9%, which is a little too low, and some had never prepared it before. So this uncertainty kind of created a hesitation toward trying and regularly consuming this okra. So participants also, as you can see here, one participant pointed that teach us new recipes of how to prepare it. I'm sure the people will eat it if they learn how to prepare it. So these kind of remarks showed that preparation knowledge can be a very important asset and entry point for kind of behavioral change. And another interesting point here also in the discussions that was raised is the relationship between demand and market supply. That the mothers believed that if the demand is there, the traders will find a way to supply it, which is a kind of entrepreneurial inputs. Okay, can we go to the next slide? Yes. So what these findings really show us is that the challenge is not simply a lack of nutritional awareness, but most participants already understood that vegetables are healthy. The bigger issue here is that whether these vegetables fit into the people's lifestyles, preferences, and the social expectations, which are very critical, especially when it comes to the youth. So for pumpkin, the stigma that is attached to it reduced the attractiveness, and particularly the younger urban consumers who often associate it with identity and more modern lifestyle. For okra, the issue was more of about unfamiliarity rather than the lifestyle choices. But many people lacked confidence in how to prepare it, which is a very critical asset. And this unfamiliarity, for me especially, food often feel like risky and inconvenient, especially when it comes to busy urban households, especially in Addis Ababa. So another important insight is that these households food decisions are usually highly negotiated. Even when women are interested in preparing healthier foods, children's preferences and conveniences, the household's acceptance strongly influence what is ultimately consumed. So from this field exercise, one thing that we have learned, we were assuming that women were the sole food decision makers at household level, but the children and fathers also have a lot to say when it comes to the food decision making. So overall, the findings suggest that improving this vegetable consumption really require a shift in perceptions and improving the familiarity through this kind of demand creation models. These are very important. Next, please. So in conclusion, we have come to the conclusion that, as you can see here, the first point is in-person cooking demonstrations are more effective than digital messaging for increasing okra intake. This is very important. And from what I have presented earlier, if you remember as well, when we connected the qualitative findings here with the trial results, the pattern becomes a little more clearer. The in-person interventions were more effective for increasing okra consumption because it directly addressed the barriers participants described during the focus group discussions as well. People needed practical exposures, like seeing the recipes, observing the cooking demonstrations in person and the methods. And particularly, one thing the in-person brings is tasting the food. Tasting the food during the practical demonstrations really helped reduce hesitation and build confidence of the participants. So at the same time, this higher effectiveness required substantially more resources, higher implementation costs, which is very important. And when it comes to pumpkin, this is, however, like we did not see a strong difference between the intervention models, as Ilana mentioned. This is likely due to pumpkin being already relatively familiar to participants, unlike okra. And another important lesson from the study is the role of engagement, which is very important. Next slide, please. So the implications, these findings that we have already discussed have several important implications for future nutrition and demand creation programs, especially for the policy makers. First, digital approach can offer lower cost scalability and wider reach, especially when it comes to urban settings. We have to be a little more careful when it comes to rural and remote settings. However, when it comes to for lesser known vegetables such as okra for Addis Ababa, in-person approaches may still be quite necessary because they allow people to interact directly with the food preparer. So ask questions and gain practical experience through testing, as I mentioned. So the study overall also highlighted the behavior change intervention that need to really move beyond simply sharing information. So interventions should be more of engaging and culturally relevant. And finally, the research demonstrates why cost effectiveness evidence is very important. In resource-constrained contexts like the situation in Ethiopia, it's not just enough to know what really works, but we also need to understand which approaches can realistically be scaled and sustained over time. So this is quite important. Thank you very much, everyone, for listening. Over to you, Ilana.
Okay, yeah, thank you. Thank you everyone for listening, and I think that is the end of our presentation. So happy to take questions now, if there are any. Okay, Matthew.
Yeah, hi Ilana, Liz, and Tinsaye. Thanks a lot for the nice presentation. And yeah, I think initially we were kind of a little bit involved in the prioritization. So I'm happy to see how the work has involved. And yeah, my main question here is on okra. And We know that most of the production is in Ethiopia is in the western part and a little bit in the northern parts. Very little production happens around Addis, and I don't know if during the discussion with the various stakeholders, assess how they can have access to the product has been thoroughly discussed, because some may be interested after this intervention in starting consuming okra, but availability and access could definitely be a big limitation, considering that most of the production is happening in other regions which are quite far from Addis. Over.
I can just, so when we were designing the campaign with the local firm that we hired, they asked this too, and Tinsaye did a nice tour of many markets and to check that okra was available, especially in the districts we were going to work in. I don't know how seasonality will affect that, but we did, at least for the time of the intervention and like the month after, there was okra in most markets, but you had to ask for it, and it wasn't necessarily a huge quantity. I don't know if Tinsaye wants to expand on that at all.
Yeah, thank you, Liz. One of the issues that was raised by the participants as well was that as long as the demand is created, the entrepreneurs will manage and find a way to supply it. And as also Liz mentioned, we had the kind of a mini survey to check the availability and the seasonality of okra. And during at least for the period of this survey, it was available.
Okay, thank you.
I see that Guy Marino has put a few questions in the chat. So one, what were the main cost drivers contributing to the estimates? Yeah, I can answer that. I mean, I think that I guess I'll answer in terms of the main cost differences, which is that for the in-person intervention that required obviously, people's transport costs to get to where they're giving the demonstration. It required all the costs of the materials for the demonstrations, or the, I guess, some small per diems for participants. And so the costs of doing in-person intervention are just, because of all the logistics involved, are just much higher than the digital intervention. The way that I calculated the cost was also, we worked with two different firms. So one who did the in-person intervention and one who did the rollout of the digital intervention. But the one who did the in-person intervention also did the sort of general conceptualization of the materials. So the materials, that part actually I just split evenly into both arms, like the labor to come up with the different I'm trying to think of the word, the campaign materials, and actually coming up with the campaign materials themselves, that was split evenly into both. But just because pushing out some text messages and doing some analytics on the data just is a lot less expensive than actually physically going somewhere and having all the materials needed for that.
I can just add, like, even the materials, like we had to buy all the cooking, the pots, like all those materials, because there wasn't a space that had those. There was no kitchen we could go use. That was also going to be very expensive. So and they needed to buy multiple, because the sessions happened at the same time in multiple locations. So they had to buy it 3 times over, kind of thing. So that did add to the cost.
Yeah, just to add on that as well. You see, the main cost drivers came primarily from this in-person intervention model. And for example, the staff cost is there as well. Venue logistics arrangements, as Ilana mentioned as well, the participant mobilization, the cooking demonstration materials, also the ingredients and transportation. And the other, which I feel is very important, is the repeated face-to-face sessions. You see, this was not done across one session, but rather, I think it was over 4 multiple sessions. Yeah. Over to you, Ilana.
Yeah. Yeah, thank you. I think the other thing I'll say is that we haven't done like sensitivity analyses yet to sort of, we could look at it from different cost perspectives as well. This is like from a sort of pilot program cost perspective. If we were, if it were to be scaled up or at a different level, I think that the cost would actually come down because, if you only have to buy materials once, but you use them over a longer period of time, and then it would ultimately be less expensive. So we can do those sorts of sensitivity analyses, I think, later on to sort of put estimates for different scenarios. But for this sort of only very short 3-month period, I think that it ended up being quite costly. Also quite costly because of low participation. So you're paying the costs for 100% participation, but you only have 30 to 50% participation. And then Guy Marino's other question was what happened to moringa. Yeah, I think it just wasn't feasible to do all three vegetables this time. So I suppose we chose pumpkin and okra. I don't know, maybe Tinsaye, do you remember why we dropped moringa out of the three?
Yes, actually it was because of the availability, the fresh availability of okra in Addis Ababa was a difficult thing to get here.
Yeah, and the other thing is actually we also did a similar prioritization exercise in Bangladesh, and they also prioritized moringa, but we had sort of originally planned to do a similar demand creation activity in Bangladesh with moringa, but we didn't end up being able to do it because of time and budget constraints. So I think that was another one of the reasons why moringa didn't make it into this one. Yeah, so do we think Stephen is asking, do we think 3 months is such a short period for digital campaign to be effective? Do you intend to do another survey after, say, 1 year? I think it's a great question. I think it would be very interesting to do another survey and continue the digital intervention for a longer time. I think that we unfortunately don't have the funds to do it, but in an ideal world, I think we would absolutely want to do that for sure. I think I agree. 3 months is a very short time.
And we wanted it to be longer, but it was just, constraints out of our control. And we wanted both interventions to go a bit longer, but this was the best we could do.
I got it.
Yeah, thank you very much. Thanks for the very good presentation. If you have to conduct another experiment, another study like this, did you see any improvement that you have to do in your methodology and in selection of the crop type, in location? Do you see any improvement that you will be incorporating in the new study, that similar study? Thanks.
I can just answer quickly. I think from my end, I would really want to focus on engagement because I think it was just sort of quite unfortunate. I mean, it's always good to see that in a real world situation, that was the real level of engagement with the resources that we had. But I think that in maybe what I really think we learned a lot about was that, we need to work very hard to get people engaged in those types of activities. And the other thing is that maybe not only just engagement in terms of the demand creation side, but I think as, maybe even though okra is available on the market and pumpkin is available, maybe also doing simultaneous work on the production side would have been good to do and would have been interesting to, I think that actually in and of itself would have potentially increased engagement because it would have, been working with another segment of the population and getting people excited about not just, recipes and consuming the vegetables, but also with production of them. So I think that they really need to go hand in hand. But yeah, maybe Liz or Tinsaye, you have other thoughts on that as well.
I think more the digital intervention, I think, could have been better. And I think just engaging people more, because at baseline we didn't assign people at baseline. We just told them you may be enrolled in one of these arms, and then they just were added to a Telegram community. And so it wasn't necessarily a text message. So I think just making sure there's a better way that they know they're in that arm, and also the data aspect, because those videos were high quality. And if they're not sure what this community is that they were added to, and they might not want to use their data to watch those videos. So I think once they were in the arms, there should have been maybe one more engagement to inform them. But I think digital has a place, but we just need to learn how to do it a little bit better.
Yeah, just to add on that, I think it's a very good question, Ricardo, that you have raised. And one important improvement for me would be combining demand creation with stronger market access, as Liz said, with the supply side support as well, especially for vegetables like okra, where the availability is a major constraint. I would also consider a longer intervention, as was raised earlier, and follow-up period to better understand or capture the sustained behavior over a longer period of time. So, because I would expect some differences between the consumption at the time of the intervention and after a year. The other is in terms of crop selection. I think it may be useful to include vegetables with different baseline familiarity levels. As we saw, very different responses between pumpkin okra. And finally, maybe expanding to different urban and peri-urban contexts, like the outskirts of Addis Ababa. It could help us better understand how local food environments influence intervention effectiveness. Yeah, thank you. Back to you, Ilana.
Yeah, thanks very much. I think we have time for one last question from Guy Marino, and then we'll close out.
If it's only one last question, someone else can talk.
Okay. Or well, let's see, because I just see one more question from Coletta. So maybe we'll do Coletta first, and if we have time, Guy Marino, you can ask your question. Coletta says, would you consider approaching mobile companies with interest in nutrition to scale your intervention? Yeah, I think it's a very interesting idea. Why not? I think it's a good idea. Okay, maybe Guy Marino, we do have time for your question.
Thank you. The reason I asked that is there's a mention of 3 months type funding, but there was a digital component that you used in trying to find your research information. And I mean, this speaks to accessibility, and there are mobile companies now have foundations that would be interested in this kind of stuff. And they do have a component around healthier people, healthier living. It depends on what the foundation interests are. So it's a good study. So yeah, futuristic thinking. Thank you.
No, it's very helpful actually to think about it that way. So I appreciate the comment, and yeah, I think it's a really good idea. Okay. Oh yeah, there's actually a few more questions. Betty says, following to Coletta's suggestion, there are also call centers which we can tap in for the future. Yeah. Maybe Jen, you have a question?
Just a small note. The insignificance effect for the pumpkin reminds me of how attitude change is just much more difficult than knowledge learning. So that reminds me how okra is a totally different case. So you teach people and then they learn, there's no barrier to that. But whereas I think the negative one, it's really difficult to change it. It's more about emotional judgment, and there are ways to influence that. But every vegetable have different
The psychology approach.
Yeah, also a very good point. Hard, very, very difficult to change long-standing opinions, especially in a 3-month period. So, and last question from Guy Marino: was the increase in okra consumption large enough in quantity or frequency to be nutritionally meaningful? I wouldn't say so. In terms of the increase that we saw, based off of the one-time data collection that we did. But that doesn't mean that, perhaps it could be established as a habit or, could become nutritionally meaningful. But I think, the less than 1 gram that we found, I suppose, is probably not nutritionally meaningful.
I should have added, I didn't put in the descriptive of the average size because I just put it, I made the variable, but I didn't put the descriptive. So that would be important to add, because maybe if it is a decent sized serving, but it's only once every 2 weeks at first. So that's to look at.
Yeah, but I think that it's a good question, but I also think that, maybe part of the demand creation activities is about new habit formation, and kind of similar to what Jen was just saying. Maybe you wouldn't expect to have very nutritionally significant changes at first, but if it becomes something that becomes integrated into someone's diet that wasn't there before, I do think that in and of itself can be nutritionally significant. It's also adding to food variety, so it's still, I think, quite positive that okra consumption increased after a short intervention, and that it's possible to do. And then we have to look at longer term effects and how to make it even better and certainly more cost effective to do that.
Yeah, I think, thank you very much, Gimar. Coletta and Wetu as well. I think these are very good suggestions. I also I concur with what they have mentioned, Ilana and Liz mentioned. The study really did show this statistically significant increase in okra consumption, particularly with the in-person intervention arm. But we should be a bit careful, however, whether the increase in nutrition is nutritionally meaningful in terms of in the long term is more difficult to conclude from this short intervention period alone. And the findings for me mainly demonstrate proof of behavioral change potential, the potential only here, and sustained and kind of repeated consumption over a longer period would need to determine meaningful nutritional impact at the household level as well. Over to you, Ilana.
I think Ilana might be moving locations, but I think we will close the seminar. And we want to thank everyone for attending and your questions and comments. And we are now writing up more results. So if you have more questions or we have other results, we just wanted to give you a sample of it. And I'll also give a quick plug to my action area, because this is a good example of the urban food systems action area and Ilana's healthy diets action areas. This is how the action areas can work together. So I'll leave it at that. Ilana, do you want to say anything?
No, I think it's a good closeout. Thank you so much, everyone, for joining, and look forward to more of your feedback later on.
All right, thank you, everyone. Bye.
Bye.